There is a critical meeting that could determine what vaccinations your kids will receive. But there are new questions this morning about that potential guidance after former CDC Director Susan Monz accused Health Secretary Robert F. Kennedy Jr. of putting politics over science.
Dun, dun, dun.
Dun, dun, dun. So we are not going to say that we told you so.
But we told you so.
Yes, the receipts have arrived. The receipts have arrived. So I am Dr. Ida Brown.
And I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond.
So Senate Democrats on the Health, Education, Labor, and Pensions Committee released a trove of internal emails this week. Emails spanning from the earliest days of the administration all the way through the firing of the CDC director, Susan Monz, last August. And those emails were provided to the committee by Dr. Deborah Horry, the CDC's former chief medical officer who resigned following Monz's ouster. So Senator Bernie Sanders, the committee's ranking member, reviewed these documents and released them publicly. And his conclusion that Secretary Kennedy, and I quote this, is, quote, prioritized politics over public health, ignored expert guidance, and endangered people, particularly children. HHS has been reached for comment by major news outlets, but has yet to respond publicly. Dr. Sloan?
Mm-hmm. So let's just walk through those emails, right? Actually show, because it's in the details. That's what matters, right? So first, the flu vaccine ad was paused. If you guys remember, in mid-February last year, 2025, during one of the worst flu seasons in recent memory, the CDC communication officially notified colleagues that HHS Communication Chief Andrew Nixon had instructed her to what? And I'm paraphrasing the email, you guys. Pull all of the campaign ads and that anyway related to any of the flu stuff, right? So, or anything that was encouraging shots or vaccinations. He told her to pull them all. What? So the staffer wrote that Nixon told her, and this is a direct quotation from the email. He said this request came directly from the secretary. A subsequent email from Nixon himself confirmed it was a direct ask from Secretary Kennedy. One of those paused ads was called Wild to be Mild, and you guys can go check it out. It's still up circulating around. But Dr. Brown, another ad called Get My Flu Shot was apparently allowed to continue.
There's a sigh.
I know.
I mean, it's like the second major episode documented in these emails involves the Advisory Committee on Immunization Practices, known as ACIP. We've spoken about it before. So it's an independent panel of scientists and clinicians that evaluates vaccines and makes the schedule recommendations. And so early in the administration, a memo from a Kennedy advisor noted that ACIP had only one vacancy at the time, and the new openings wouldn't arise until 2027. So the stated concern in the memo's own language was that this gave Biden appointees, quote, significant sway over ACIP and its recommendations until 2028, end quote. So the stated objective for restructuring the committee was to, again, quoting the memo, depoliticize the committee by installing people more aligned with the secretary's agenda.
Yep. You got the receipts. We've got the receipts today. So you guys remember also in June last year, Secretary Kennedy removed all 17 of those sitting ACIP members, which was an unprecedented motion, a movement of action that no one thought or saw coming, right? And pissed a whole bunch of people off. And then he announced it where in the Wall Street Journal op-ed, writing that, quote, a clean sweep is needed to reestablish public confidence in vaccine science. The medical community responded like crazy. And we were definitely on that tip as well. The American Medical Association said the move undermined the trust and upends a transparent process that has saved countless lives, right? So the president of the Infectious Disease Society of America called Kennedy conflict of interest allegations against the committee completely unfounded. And critically, a federal judge ruled in March that the administration had disregarded required processes to make those changes. So the removal was found to be what? Unlawful.
So the third thread concerns the ouster of CDC Director Susan Monz. And so the emails show that Kennedy's then chief of staff, Matthew Buckham, emailed Monz in August 2025 about the need for what he called a political review of major decisions at the CDC. So to ensure that, quote, the immediate office of the secretary and CDC political leadership all have eyes on the decisions for approval and changes before they go into effect. So less than a week later, Monz was fired.
Go figure. Yeah.
Right. Mm-hmm. So, Senator Sanders, he described this dismissal as her being terminated for, quote, failing to rubber stamp ACIP recommendations. That would be the new ACIP recommendations, right? So Monz later testified to the Senate that Kennedy pressured her to agree to upcoming changes to the childhood vaccine schedule and to commit to firing CDC scientists. And when she refused, she says, Kennedy told her he had already spoken to the White House about her removal. So HHS has actually strongly denied those characterizations.
Yeah, but from that final standpoint, and we want to be clear, right? What matters is the process, not just the politics. So the advisory committees like ACIP exist precisely to separate the science from the politics. And they hold a public meeting. That's accountability, right? And they disclose conflicts of interest, like what some other people have not done. And the recommendations go through a strict deliberation, right? So that process exists because the history of public health is full of examples of what happens when political pressure overrides expert consensus. We've already seen it, right? So whether every decision made under this administration ultimately proves to be medically sound or not, the way that the decision process is being made and the integrity of the process behind them determines whether clinicians like Dr. Brown and myself and patients and the public will be able to trust their guidance that they receive from these people.
So now we have one more data point, right? In the weeks following Monz's firing, the CDC reduced, surprise, the number of recommended childhood immunizations from 17 to 11. So she leaves, and then they reduce the amount of recommended immunizations. So public health organizations warn that the change could create confusion and leave some children more vulnerable. And the administration argued the revision mirrored practices in other Western countries. So the debate is now public, and with these emails in hand, Congress has the documentary record it needs for informed oversight. Now, Senator Sanders has called for a bipartisan investigation, and we will keep watching.
Yep, I think that's very important. So let's roll this next clip then.
For me, there's an immediate pragmatic reason for this phone call. And the question for you is not whether a Republican is going to solve any of the problems that you're dealing with, that you're concerned about, or whether you may be able to solve more problems in a different position. And in going in and winning 3 or 4% of an election. So that's just, it's a break. I admire what you're doing. I admire your idealism. And, but, ultimately you have to ask yourself the same question I did. Is it more important for me to run as an independent, make a point, or could I make an agreement that puts me in a position where I can make a real difference in people's lives?
Receipts, people, receipts today. Yes. Dr. Brown.
Yeah. So now to a story that does not involve vaccines, mortality data, or public health budgets. But it may carry serious consequences for the nation's top health official. The Washington Post published an audio recording this week that we just heard of HHS Secretary Robert F. Kennedy Jr. on a phone call with a Libertarian congressional candidate in Iowa, a man named Rick Stewart, who is running in the state's 2nd congressional district. And the content of that call has raised immediate questions about federal law. We heard it, right, Dr. Sloan?
Yeah, and according to that post, or the Post reporting, which was also confirmed by audio obtained by the Gazette of Cedar Rapids and broadcast by Gray Media Iowa. So receipts, again. Kennedy called Stewart on June 11th, and he urged him to consider dropping out of the race. And Kennedy told Stewart he was acting as, and this is a direct quote from the recording, a liaison to the White House. He warned that a Democratic takeover of the House of Representatives would undermine Trump's presidency, his agenda, if you will. So he suggested that if Stewart stepped aside, he could, and quote, make an agreement that might give him more impact from a symbolic run of office. And so on that call, Kennedy also said, I can't go into the specifics because there are legal provisions about that. What? Yeah.
I mean, his voice is so distinct, so we know it's definitely him on the call, right?
Exactly.
So Stewart, who's 74 years old and a veteran of multiple Iowa libertarian campaigns, said he interpreted the call as a clear, if carefully worded, attempt at quid pro quo. So he told the Washington Post that he was very careful about the words that he used, but the whole implication is you help us, we'll help you. Quid pro quo. So Stewart said he understood Kennedy to be implying that he could receive a position in Washington in exchange for withdrawing from that race. So Stewart declined. He's still in the race, but this was not an isolated call because according to the Des Moines Register and subsequent reporting, Kennedy also called Libertarian candidate Marco Battaglia, who is running in Iowa's 3rd congressional district, on June 8th with a similar message. And Battaglia also declined, but that call was not recorded. So the Libertarian Party of Iowa chair, Stephanie Berlin, sat in on Stewart's call and recorded it. So that's why we were able to listen to it. The HHS department did not respond to requests for comment from the Post or from local Iowa outlets.
Ooh, it's getting juicy now. And so now a word from the legal framework, because we want to be very precise here. We're not alarmists, right? But the Hatch Act is a federal law, and we've talked about this before, that restricts political activities of executive branch employees, which they serve in official government capacity, right? So its purpose is to keep federal agencies nonpartisan or influence their office of affect elections, how they may affect elections. Cabinet secretaries, including RFK Jr., Secretary of HHS, are permitted to participate in some of these political activities, but they generally cannot use their official authority or position to influence the outcome of an election or pressure candidates for political advantages. So you guys may want to roll this back and re-listen to this podcast, just in case. I'm just saying.
So, whether Secretary Kennedy's calls actually constituted a Hatch Act violation is not a determination that we in the media, right? Dr. Sloan, can make. But that would require an investigation by the U.S. Office of Special Counsel, examining questions like, was he acting in his official capacity? Right? His official government capacity?
He was, yeah.
Right? Or were any government resources used? Was his position as a cabinet secretary leveraged to apply pressure or imply rewards?
Sound like it.
So government ethics experts quoted by the Post, including Daniel Caputo of the Campaign Legal Center, a nonpartisan voters' rights organization, said that Kennedy's intervention was, quote, unethical and potentially illegal, but acknowledged that proving a Hatch Act violation could be legally difficult. And again, Kennedy declined to comment directly, and his spokesperson has not responded to inquiries.
Of course not. And so there is a broader question here that we want to name very directly, that the Secretary of Health and Human Services oversees a department responsible for responding to disease outbreaks, things like measles and TB and whooping cough, right? Administering Medicare and Medicaid, regulating the food and drug supply for 330 million Americans. So in the same week that these recordings emerged, remember the New York Times separately reported that critics inside the department say that Kennedy hasn't even been at work, you guys. He's been absent day to day for the oversight focused on what his priorities are supposed to be, including issuing now dietary guidance, purposing his longstanding skepticism on vaccines and other things. He's pushing his own agendas. But to be fair, supporters in the administration said that Kennedy is pursuing long overdue reform and that political involvement by the cabinet secretary is a normal feature for any administration. I definitely would not call him normal, but nonetheless, it's a legitimate debate. Okay, we'll give him that. And it's not a dispute. We're not talking about what we just heard, because the audio that you guys just heard, that is fact. Those are receipts and they do exist. And the federal ethics authorities may now be asked to what? Weigh in. And then you thought it was over. There's more, of course.
So, today we followed several threads, internal emails, an audio recording, and a nomination. Each one's a separate story, but they're all tied into this fundamental question. What does it mean for the public health of our country when the line between political priorities and institutional independence become very difficult to see? And it is a question that oversight hearings, confirmation processes, and federal investigators will now have to work through.
Yeah. And that's why you have to stay informed, you have to stay vigilant, and you have to stay loud. So we're AIA contributors, MeidasTouch Network, and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Have a good week, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.